The isolation is also important. If someone was asked to isolate themselves, at some point they should de-isolate themselves 14 days after the onset of symptoms if they had a mild disease, and 14 days after achieving clinical stability for those with moderate to severe infection. So the duration is very, very important. But remember, the duration of viral shedding can be longer than even 2 weeks. Where the discussion on in terms of those who are still positive after they've been declared recovered. And the NICD opinion I got was that we should do a test once for diagnosis, and a follow-up test should be done in selected cases. Like maybe somebody's a teacher, they're going to face a lot of children at school. We need to know. We need to try and test more than once, or maybe a healthcare worker, but we shouldn't do a second test as a routine, because the problem with these molecular tests, which is not new, even for drug-resistant TB or tuberculosis in general, we have this problem with molecular technology. It could remain positive even after your patient is cured and non-infectious. So this is a space to watch, and we wait until we get more information. We shall come back to you. But this is a side effect of or a challenge linked to all molecular tests. That is why, for example, for drug-resistant TB, we diagnose with ExPERT, which is a molecular test, but we follow up with microscopy and what to call simple microscope and culture. That's what we use for follow-up. But for coronavirus, it's still new. We are learning. We don't know how is this going to unfold. So in a nutshell, colleagues, this is how you de-isolate for asymptomatic patients who are going to be diagnosed in the private sector. You de-isolate 14 days after initial positive test. For mild cases, it will be 14 days after symptom onset, and 14 days after clinical stability for the severe cases. This will mean that, for example, if someone was put under ventilation, you will then wait till you count 14 days from the time that they are disconnected from ventilation, not from the time of diagnosis. So recording and reporting is critical. We talked about it. The form is known. Please don't forget to capture ID numbers, province. There are various tools for recording and recording. I will not go through all this, but I'm sure when they were introduced, you were explained to as to how to use them. Now, in terms of palliative care, patients who do not qualify for intubation and ventilation, when you feel they've reached the final stage of disease, there's no need to intubate and all that, would still need support, still spiritual, psychological support. So it's important that you involve palliative care, but it's still important to examine these patients and provide palliation for whatever condition they have, be it anxiety, increased secretions, and all that. You need to also monitor vitals, and if they're unable to eat, provide them food with other means, maybe oral fluids, as tolerated, or feed with a tube, whatever it is, regular oral care. And I'm providing a table here. There is a table in the next slide which gives an idea in terms of the drugs that can be used for fever, for nausea, for breathlessness. If they have a cough, how can you control it. If the problem is anxiety, you also have those items like lorazepam, clonazepam that could be used to control a patient, put a patient at ease. If you have a lot of respiratory secretions, you might not have a suction at your disposal all the time. So you could give a drug like Buscopan to decrease that. We know that delirium could be an issue. Use haloperidol and whatever you have, which is indicated here. Constipation, you could deal with using Senokot. So these are some of the ideas for palliative care. So in conclusion, I'd like to say that this training course is really based on NDOH Clinical Management Guidelines, version 3 of 27 March. It is going to change rapidly. So look for further changes. We are still going to experience we're still going to have new versions. Your contribution is essential to the fight against COVID-19. And I think your most important contribution will be adherence to NDOH guidelines. Adherence for all of us, whether you are working in the office or you are working wherever you're working, adherence will be really critical to deal with this, to prevent this condition. So I'm ending my presentation there, colleagues.